Hello everyone, now let us discuss about 2023 coding guidelines for initial and continuing intensive care services. This comes under the evaluation and management services chapter. Now coming to the codes, these are pediatric codes. The codes 99477 represents the initial day of inpatient care. Initial day of inpatient care for the child who is not critically ill. We have separate critical care codes for pediatrics. Who is not critically ill but requires intensive observation, frequent interventions and other intensive care services. And the codes 99478 and 99480. 78, 79 and 80 are used to report the subsequent day services of directing the continuing intensive care of the low birth weight, that is LBW, between the range of 1500 to 2500 grams present body weight infant, or very low birth weight VLBW, which is less than 1500 grams present body weight infant, or normal, that is 2500 grams to 5000 grams present body weight newborn who does not meet the definition of critically ill. These codes must be coded to the infants who do not meet the definition of critically ill. They are not critically ill, but they require intensive observation, frequent interventions and other intensive care services. And these services are for infants and neonates who are not critically ill but continue to require the intensive cardiac and respiratory monitoring, continuous and or frequent vital signs monitoring, heat maintenance, enteral or parenteral nutrition adjustments, laboratory and oxygen monitoring, constant observation by healthcare team under direct supervision of the physician or other qualified healthcare professional. And the codes 99477 to 480 may be reported by a single individual and only once per day per patient in a given facility. They can be reported by a single individual once per day per patient in a given facility. If readmitted to the intensive care unit during the same hospital stay, report subsequent 99478 to 99480 for the first day of intensive care. For the first day of intensive care, you need to use the codes 99478 to 99480, and for each successive day that the child requires intensive care services. They must be reported by a single individual only once per day per patient. And if the patient is readmitted, then you need to use the subsequent codes for the first day of readmission also and successive days. These codes include the same procedure that are outlined in the neonatal and pediatric critical care services section, and these services should not be separately reportable. That is, they include the same procedures that are outlined in the, when we discussed about the neonatal pediatric critical care services, we have discussed about some of the procedures that are included or bundled in that codes. Those same codes or procedures are bundled here also, and they should not be reported separately. For further understanding, you can refer the video on neonatal and pediatric critical care services. There you have a detailed list of procedures. Here we are just telling the points. Those procedures that are covered under those services are covered by these codes also, and they should not be reported separately. Next point is the initial day neonatal intensive care code 99477 can be used in addition to 99464 or 99465, which is nothing but attendance in delivery or birthing room resuscitation. These codes can be used in addition to these two, 464 and 465, as appropriate when the physician or other qualified healthcare professional is present for the delivery, that is attendance for delivery or resuscitation, that is 99465 is required. In this situation, you need to report 25 modifier along with the procedure 99477. You need to append 25 modifier to the 99477, which is nothing but initial day neonatal intensive care code. Other procedures performed as a necessary part of the resuscitation, for example, endotracheal intubation 31500 are also reported separately when performed as a part of pre-admission delivery room care. And in order to report these procedures separately, they must be performed as a necessary component. In order to report these procedures separately, they must be performed as a necessary component of the resuscitation and not simply as a convenience before admission to the neonatal intensive care unit. They must be performed as a necessary component, then only you can report these codes separately. And the same procedures are included as bundled services with the neonatal intensive care codes are those listed for the neonatal and pediatric critical care codes. This point I have said earlier also. Certain procedures are bundled in the neonatal and pediatric critical care codes. And those same procedures are bundled in these procedures also and cannot be reported separately. And when the neonate or infant, next point is when the neonate or infant improves after the initial day and no longer requires intensive care services and is transferred to a lower level of care, then the transferring individual does not report a per day intensive care services. Here the neonate or infant has shown improvement and is transferred to a lower level of care. Then the transferring individual, that is the physician who is transferring, he cannot report a per day intensive care service, that is 99477. Subsequent hospital inpatient or observation care that come under the category 992312 or subsequent normal newborn cares, they are 99462, is reported as appropriate. The transferring individual will either report subsequent hospital inpatient or observation care or subsequent normal newborn care based upon the condition of the neonate or infant. But he will not report an intensive care service per day. And if the transfer to a lower level of care occurs on the same day as the initial intensive care service were provided by the transferring individual, in that case 99477 may be reported. On one day, the physician is providing the intensive care services and on the same day, patient is improved and is transferred to a lower level of care. In that case, the transferring physician can report 99477. If the transfer to a lower level of care occurs on the same day as the initial intensive care service. Next point is when the neonate or infant is transferred after the initial day within the same facility to the care of another individual in a different group. When the neonate or infant is transferred after the initial day, that is in the second day or third day, within the same facility, here the neonate is not getting transferred to a lower level of care. Within the same level, within the same facility to the care of another individual in a different group, then in that case, both the individuals, the transferring individual and the receiving physician, the transferring physician and the receiving physician will report subsequent hospital inpatient or observation services. When the neonate or infant is transferred after the initial care within the same facility to the care of another individual in a different group, both individuals, that is the transferring physician and the reporting physician, will bill only subsequent inpatient or observation care codes, that is 992312, 99233. Next point, the receiving individual reports subsequent hospital inpatient or observation care or subsequent normal newborn care. The receiving individual may report either subsequent hospital inpatient or observation care or a subsequent normal newborn care. When the neonate or infant becomes critically ill on the day when the initial or subsequent intensive care services have been performed by one individual and is transferred to a critical care level of care provided by different individual from a different group. The transferring individual reports either time-based critical care services performed, that is 99291 or 292, for the time spent providing the critical care to the patient, or the initial or subsequent intensive care services, but not both. Here the patient is not critically ill but becomes critically ill on the day when the initial or subsequent intensive care services have been performed by one individual and is transferred to the critical care level to a different individual. Then the transferring individual or the transferring physician reports either the critical care service codes, that is 99291 or 99292, for the time spent providing the critical care to the patient, or he can code initial or subsequent intensive cares, but not both. That is 99291 and 99477 series are not coded together. In this case, he cannot code both. Either he can code the critical care services or initial or subsequent intensive care, the transferring physician. Now coming to the receiving physician, the receiving individual reports initial or subsequent inpatient neonatal pediatric critical care codes, that is 99468 to 99476, based upon the age and whether this is the first or subsequent admission to the critical care for the same hospital stay. The receiving individual will code the pediatric critical care codes, neonatal or pediatric critical care codes, and the transferring individual will either code the time-based critical care services or initial or subsequent intensive care, but not both. Next is when the neonate or infant becomes critically ill on the day when the initial or subsequent intensive care services have been performed by the same individual or a group. Report only initial or subsequent inpatient neonatal pediatric critical care based upon the patient's age. Here, same physician is performing the critical care services and the initial intensive care services. When the neonate becomes ill on the day when the initial or subsequent intensive care services have been performed by the same individual or group. Report only initial or subsequent inpatient neonatal or pediatric critical care codes based upon the patient's age and whether this is the first or subsequent admission to the critical care for the same hospital. And for the subsequent care of the sick neonate younger than 28 days of age but more than 5,000 grams who does not require intensive or critical care services, then you can code the subsequent inpatient or observation care codes, that is 99231 to 99233. For the subsequent care of sick neonate younger than 28 days. Here the neonate is sick but not critically ill and the weight is more than 5,000 grams who does not require intensive or critical care services. Then you can code the subsequent inpatient observation care services, hospital inpatient or observation care services. Now let us discuss the CPTs. The first one is 99477. This is initial hospital care per day for the evaluation and management of the neonate 28 days of age or younger. 28 days of age or younger who requires intensive observation, frequent interventions and other intensive care services. Then you need to report 99477. And for the initiation of inpatient care of a normal newborn, you need to use the code 99460. For the initiation of care of critically ill neonate, you need to use 99468. And for the initiation of hospital inpatient or observation care of the ill neonate not requiring intensive observation, frequent interventions and other intensive cares, then you can report initial hospital inpatient or observation care codes that are 9922212 99223. The next code is 99478. Subsequent intensive care per day for the evaluation and management of the recovering very low birth weight infant. VLBW. Very low birth weight infant. Present body weight is less than 1500 grams. When the present body weight is less than 1500 grams and the patient is receiving the subsequent intensive care for the evaluation and management, then you need to report 99478. And the subsequent intensive care per day for the evaluation and management of recovering low birth weight infant. If the patient's neonate's birth weight is low, that is if the neonate is weighing between 1500 grams to 2500 grams, then you need to report 99479. The next is 99480. Subsequent intensive care per day for the evaluation and management of the recovering infant. The present body weight is 2500 grams to 5000 grams. Here the patient is not underweight. 99480 must be reported for the subsequent intensive care per day for the evaluation and management of recovering infant. If the body weight is between 2500 to 5000 grams. Now let us see an example here on day 1 of the hospital stay. That is, neonate has been delivered. On the day 1 of the hospital stay, the name of the neonate is Lucky. Lucky starts to show signs of persistent hypothermia. And the provider documents, the physician documents intensive observation, frequent interventions and continual monitoring. In this case, first you need to report 99460. On the day 1 only, this is on the day 1, that is on the delivery, date of delivery, first you need to report 99460. Initial or hospital care or birthing center care per day for the evaluation and management of normal newborn infant. Followed by 99477 with 25 modifier. Initial hospital care per day for the evaluation and management of neonate 28 days of age or younger, who requires intensive observation, frequent interventions and other intensive care services. For better understanding, if we look at the normal newborn care codes that are 99460 series, under it you will find that when a normal newborn services are provided, when the normal newborn services are provided by same individual on the day that the newborn later becomes ill, here the same physician will provide the normal newborn services, and after that on day 1 the neonate shows signs of persistent hyperthermia, and then the provider documents in the same physician or the provider documents intensive observation, frequent interventions and continual monitoring. And on the same day, the newborn later becomes ill and receives additional intensive or critical care services. Here the patient, in our current example, the patient is receiving intensive care services. Report the appropriate E&M with 25 modifier for these services in addition to the normal newborn care code. So in addition to the normal newborn code, you need to report these intensive care services along with 25 modifier. That is the reason first we are reporting 99460 followed by 99477 with 25 modifier. This is a guideline under the normal newborn services. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.